A pleasant day, everyone. We have just viewed the story of the De La Cruz family. The next part of the presentation will be on the family assessment and family intervention. In conducting family assessment and intervention, there are 5 essential ingredients in order to work with families. These are manners, therapeutic conversation, family genograms and echo map, therapeutic question, commending family and individual strength. First is demonstrating good manners to the family. The most basic act of introduction in a correct manner is an essential ingredient to a successful interaction and invite trusting relationship by introducing yourself to the client. Always address the client by name and title. Acknowledge their thoughts, feelings, and what matters to them. In addition to addressing appropriately, conveying respect displayed in demeanor, posture, expression, attitudes, speaking with welcoming tone of voice, and choosing questions carefully are ways to demonstrate polite, courteous, and thoughtful manners. Genogram and echo map are used as an engagement tool to develop broad view of the family. It uses symbols and identifier and depicts family relationship among identified members. Genogram is a diagram mapping the De La Cruz family patterns and relationship at least across 3 generations. Name and age are noted inside symbols, and outside are significant data from the family, like medical condition and occupation. Family members are placed on horizontal lines and children are denoted as vertical lines. The echo map is a diagram that shows the personal and social relationship of individual to his or her environment. This also uses symbols to depict the pattern of relationship. For example, a broken dotted arrow represents Florentino's distant relationship to the community health center, while a double green arrow represents a strong relationship with good energy flow in relation to his parents.
Hi, my name is Shijimal Matthew. Therapeutic conversation is the second element. It is focused and planned. The nurse uses therapeutic questions to engage the family. The questions are specific for the context or family situation but have the following themes. Family expectations of the interview, sharing of information. Within the family meeting with the Dela Cruz, useful identified relevant key questions to ask are: whom does the family consider as family? Which of the family or friends would you wish or not wish to share the information with? Rationally, family identifies family type, members, roles of the family, key alliances, resources, and conflicts. The next question is: within the family, whom do you believe is most distressed at this time? This can help to identify those with the greatest need of support and interventions. How does a recent illness issues are affected the family? Illness and family issues cause stressful situations and reactions to and deal with may vary among the family members. What do the family members believe or expectations about roles of professionals, roles of the family have to their own health problems? Disagreement among family members produces conflict and draws on energy and emotional resources needed to handle health problems. What strengths do you, the family members, believe the most influential coping they have in dealing with the health problems? If family members do not receive strengths, they will have difficulty coping with the health problems. Asking the perception will gather information on the family member's view and can provide basis of the intervention. Commendations involve recognizing family's competence, resilience, and strengths and offering them a new opinion or view of themselves that allows the family to then discover to their own solutions to the problems and enhance healing. The following are the recommendations that can use health patterns. You have been supportive of your family's health. Values and commitment. Your family have shown strength and commitment in their roles in trying to adapt to changes. Coping mechanism. Your family have shown much courage during these difficult times. Problem solving and communication. I appreciate the willingness to come over and talk about your concerns, family resources, spiritual well-being, and support. Your family displays such a strong sense of commitment when it comes to family responsibilities. Combinations are particularly effective when the family seems dispirited or confused about tragic illness or accident. By identifying one positive factor, a family may feel empowered to push through difficult situations, and families who internalize recommendations offered by nurses.
Important psychosocial consideration to examine the De La Cruz family includes Lifestyle information determine the family's significant relationships, available support people, marital status, occupation, religion, and other important components of the family's lifestyle. Normal coping patterns identify which coping mechanisms the family uses when under stress and which he or she used during past stressful events. Understanding of current illness. Ask the clients about their understanding of the diagnosis of the reason for seeking medical attention and determine how Florentino and Christina view their illness and how it is affecting their life. Personality style. After interacting with the family, identify any important personality traits that may affect the members' care of compliance, such as a tendency to be dependent, hostile, dramatic, or critical. History of psychiatric disorder. Consider asking if any of the family members has experienced any psychiatric symptoms such as depression. Recent life changes or stressors. Determine if there have been any major or traumatic events recently, especially in the last year, and keeping in mind that these changes may be both positive and negative. In family Dela Cruz case, the changes are financial problem due to the recent layoff, role change, pregnancy, and sick family member. Spirituality. Determine the role of spiritual and religion. Use of hope assessment includes question as follows: H. Sources of hope, strength, comfort. O. Role of organized religion for patients' personal spirituality practices. And E. Effects on medical care and end-of-life decisions. Major issues raised by current illness. Determine how the illness has been affected the patient's lifestyle or sense of self, including areas such as self-esteem, body image, loss of intimacy, role changes, and changes in the life in family dynamics. Mental status examination. Perform the mental status examination to help identify dysfunction in emotional, cognitive, or behavioral spheres. Each member of the family exhibits unique behaviors related to the ongoing situation that their family is experiencing. Assessment of psychosocial behaviors manifested by the family members are important factors in examining this family, which gathers information on behavior and appearance, mood and emotions, thoughts, beliefs and perceptions, relationships and interactions.
Family assessment tools. So what tools would you use to engage and support the family? Family assessment with different approaches and models enables nurses to analyze family as a unit. These instruments help to identify current family stressors and build intervention based on strengths. Looks on families in the larger community level, functioning, affective, and behavioral aspects. Family assessment and intervention model. As reflected in the case, the stressors that the family is facing and how they communicate and manage stress are important to promote health, wellness activities, problem identification, and restoration of family stability. Second one is an assessment and intervention instrument. It is used along with family assessment and intervention to assess the stability of the Cruz family through gathering of family stressors and strengths. The third one is the use of structural and developmental assessment tools such as genograms and echo maps would also beneficial to guide family plan of action and selection of intervention. Model for health promotion using the McMaster model of family functioning, which specifies the 6 domains of functioning with the greatest impact on the ability of the family to meet the basic needs, developmental needs of family members, and emerging needs such as crises that arise from illness or job loss. The fifth one is the therapeutic conversations and therapeutic use of self. And these are another key tool. This type of conversation is focused, purposeful, and engages the family. The art of listening is paramount.
The family challenges, strengths, resources, and competencies. Major family deficiencies and stressors. Impact of health pattern and change in function of a family member. Florentina's smoking and alcohol abuse and his attitude towards participating in a healthy self-care and refusing to seek help to address his concerns. Anna's self-image disturbance that sought to limit herself to functions that do not require much public interaction and exposure due to her facial disfigurations. Physical health of Christina is at risk, brought about by the family's present situation combined with role overload between her job and family, unplanned pregnancy, and hypertension poses a lot of concern to Christina, resulting in intermittent headaches and disturbed sleep pattern. Another stressor is the pressing issue of low living wages and impact of addition of family member to sustain the family. Changes in routine and roles. Florentino's remorse in finding a job that is related to his profession, the stress brought about by his previous layoff, current job status and financial instability to support his family. Christina and Florentino must adjust their routines and role to meet family needs. The family is facing developmental stressor in relation to pregnancy and expecting of addition of family member. Tense in the family relationships and interactions. Armando prefers spending his free time playing video games in his room or with his school friends, and Anna kept her feelings to herself. The couple had several bitter arguments concerning Florentino's recent smoking and drinking habits. The family feels stressed by the changes magnified through loss of connection, tension in the family relationship, and changes of routines and roles. The couple's intimacy is altered by the tension in their relationship. The family's strength and resources includes religious community affiliation, family relationship and values, support from extended family members, community resources such as health center, family income. Family competencies. Though Christina has 2 jobs and is currently pregnant, she assumes the role of primary caregiver of her 2 children and enthusiastic about enrolling on further studies. Christina is adaptable and she is able to make decisions with regards to finances, parenting, health, and leisure activities. Despite the issues of Florentino, he is still functional and manages to work, attends to church, and contributes to some household chores. Both children are doing well in their class and
My name is Susan Kamau, and as a member of Group 4, I'll be talking about Dela Cruz family goals and interventions. The priority focus areas for the Dela Cruz family includes smoking and alcohol intake cessation, coping and weight loss strategies for Mr. Florentino, planning, time management, load sharing, and coping strategies for Christina so that she is able to divide her time appropriately between her job, home, and herself. Due to her pregnancy, it is very important for her to take good care of herself and to avoid stress. Establishing trust. This will help build the needed connection and enhance support resources. To help the family cope up with the new environment, and family intervention need to be tailored to each family member individually with consideration of family structure, function, and process. Considering the social and financial risk, a family now serves as a catalyst for deploying appropriate intervention. An ongoing assessment. This is to gain an insight of the family perspective of the situation, to identify the support that they need, and determine the changes and outcomes of interventions. Family health promotion. This is significant as it enhances the emotional, physical, biological, and spiritual limb of the family members and the family as a unit. Several intervention and strategies need to promote health can be applied, such as centering on coping mechanism, empowerment, promotion of family integrity, maintenance of family process, lifestyle modifications, environmental management, use of leach support system enhancement. Offering information, drawing forth family support, and focus on building resources are some of the strategies to assist the family. Intervention on Florentino's alcohol abuse and smoking. Desired outcome for Mr. Florentino will be to identify effective coping behavior, use of effective coping, problem-solving skills, and lifestyle modification, encouraging him to verbalize his feelings, fears, and this may help him to come to terms with long unresolved. Exploring stress coping strategies and client perception on this area, like joining membership club like YMCA, community bowling team, identifying support groups in the community for alcohol abuse treatment and smoking cessation management, such as a community such as a AAA. This would promote access to community support resources, encouraging Mr. Florentino to take control over his own behaviors. This would promote acknowledgement of consequences of alcohol use and give him support. Christina, the intervention will be focused on stress reduction and management, identifying and expressing of stressful feelings, own strengths and abilities, assessing current environmental stresses, and identifying community resources, working with her on incorporating stress management strategies such as yoga, relaxation breathing, meditation, use of music for relaxation, etc. Exploring with Christina her previous methods of dealing with stress or problems and her achievements, and providing her with information on cost-free counseling and support groups. Another intervention for Christina would be to promote healthy pregnancy, helping and supporting on the process of decision-making regarding sharing with her family members about her pregnancy. The degree of acceptance will be reflected on her emotional responses. Advising and encouraging Christina to visit her doctor for a full review of her current medication. Christina is currently taking antihypertensive medication, which may affect her pregnancy. And lastly, providing her with resources on community support groups, especially with pregnant women, where they can share ideas and encourage each other. For Anna, intervention will be focused on promoting positive self-esteem. Anna is at least for developing negative perception of self-worth due to a disturbed body image. Nursing interventions for her to enhance her self-esteem would include encouraging her to maintain highest level of functioning, encouraging her to verbalize her thoughts and feelings, supporting and promoting use of effective, creative problem solving such as writing exercises or ventilation of feelings. And lastly, providing and supporting her in finding a self-help or therapy group that focuses on self-esteem enhancement.
The final part of the presentation is about family evaluation. Together, the nurse and the family determines whether the outcomes are being reached, are partially being met, or need to be redesigned. Whether the care plan is working or a new plan is needed to be put into place, or does the nurse-family relationship need to end. As family health nurses, it is very important to keep in mind that each family is unique with its own combination of strengths and weaknesses, that every family has a story to tell, and that the goal is to think together and work together with the family. And this concludes our presentation. Thank you very much.